Hello, I'm Dr. Brun. If you don't know me, I'm one of the GPs at Elmham Surgery and one of the doctors who fits coils. This short video is about the hormonal coil, otherwise known as the intrauterine system, or IUS for short. There are a few different makes of hormone coils. The commonest one is the Mirena Coil, which is the one we tend to use, so the information following is about the Mirena Coil. Hormonal coils are different to copper coils. Though they are fitted in the same way, they have differences, and I'll talk about copper coils in a separate video. You may be watching this because you've been asked to by one of us before having a coil fitted. This is to make sure you understand before your procedure what it is, how it works, and the advantages and disadvantages of having one. The Mirena coil is a small plastic T-shaped device which is inserted into the womb. Here's a demo one so you can see the size and shape of it. It contains a form of the hormone progestogen, which is gradually released into the womb. It's safe for most people to use, even those who have never had a baby. There are a few health conditions where we need to avoid using a Mirena coil. These include breast cancer, cervical cancer awaiting treatment, endometrial or womb cancer, current sexually transmitted infections, STIs, pelvic inflammatory disease, severe infection post-childbirth or abortion, HIV infection, liver disease, and pelvic tuberculosis. Some of these are very rare, but the commonest one to consider is an STI. More on that shortly. The hormonal coil has three main uses. Firstly, it is a form of a long-acting reversible contraception. It's very effective at preventing pregnancy, over 99% effective. For contraceptive purposes, it lasts for 8 years. Once it's removed, your fertility returns. You can keep having hormonal coils fitted every 8 years for as long as you want or need them. Secondly, it's a very effective treatment for heavy periods. While it can take a few months to settle down, by 12 months, many women will only have a day or two of spotting a month. 1 in 5 will have no bleeding. Some may get slightly more frequent spotting, but it's usually very light. Because it reduces blood loss dramatically, it also helps reduce painful periods too. Thirdly, it can be used as part of HRT. For heavy bleeding and HRT, it lasts for 5 years. The hormone coil works in a few ways. It thins the lining of the womb. This reduces bleeding, and it also prevents a fertilised egg implanting. Secondly, it thickens the mucus at the entrance to the womb, preventing sperm entering the womb. And thirdly, in some cases it prevents ovulation or an egg being released. The benefits of a coil are: it's very effective, there's no need to remember to take a pill every day for contraception. It reduces heavy bleeding. It releases hormones locally, directly into the womb. Because of this, there are less side effects than oral or tablet contraceptions. Side effects can happen, particularly in the first 2 or 3 months, but they tend to quickly settle and be mild. For any contraceptive containing this same hormone, including the hormone coil, side effects include headaches, breast tenderness, acne, low mood, and ovarian cysts. While the coil is excellent at preventing pregnancy, on the rare occasion it fails and pregnancy occurs, there is a slightly higher than normal risk of that pregnancy being ectopic. This means it doesn't grow in the correct place in the womb. This can be very dangerous, so it's vitally important any pregnancies associated with a coil are reported to us straight away, as an urgent scan needs to be arranged. Because the coil sits inside the womb, a small procedure is needed to fit it. This is a little bit like having a smear test, but it lasts a bit longer and can cause some tummy cramps. It involves passing the coil in its insertion tube up through the vagina and into the womb. We use an instrument called a speculum to allow us to gently open up the vagina enough to see. This is the same instrument that we use during a smear test. We use a local anaesthetic spray to numb the entrance to the womb to help reduce pain. We then measure the size of the womb with a special very thin ruler before inserting the coil. The process takes approximately 15 minutes, and while most people tolerate it very well without problems, there are a few potential complications to be aware of. Firstly, in approximately 1 in 20 women, the womb sees the coil as a foreign body and pushes it out. This tends to happen in the first few months of fitting if it's going to. Secondly, 1 in 100 will get an infection as a result of the coil fitting. This can happen if there is infection sitting in the vaginal canal, which is then pushed up with the coil into the womb. Because of this, we ask all women to do a self-taken vaginal swab to check for chlamydia before the time of fitting. You can collect a swab kit from reception desk. Please read the leaflet and return it once completed. Do write your name and date of birth on the label. This must be done well before fitting to give us a chance to get the results. The sooner you do this, the better. Thirdly, there is a 1 in 500 risk that when we introduce the coil into the womb, instead of it sitting nicely inside the womb, it pushes through the muscular wall of the womb and falls down into the pelvis. This is called a perforation. It usually happens at the time of insertion or within the first few days. It tends to cause pain and bleeding, and this needs keyhole surgery to remove it. It is more common in women who have recently had a baby and are breastfeeding. Because of this, we never fit a coil shortly after a baby has been born. We prefer to wait until 6 months after delivery and use another form of contraception to cover until then. The coil has fine, very fine threads that hang out of the bottom of it into the vaginal canal. Hang out from the bottom of the coil here. You can see the threads around here, and we snip them. You'll be able to feel the threads if you insert your finger up inside your vaginal canal. They shouldn't interfere with sex. You'll be shown at the time of your fitting how to feel for your own threads. You'll also be told what to do if you can't find them. It's important to check for your threads so you know the coil is sitting in the correct place in the womb and that it hasn't been expelled. Sometimes the threads can wiggle up inside the entrance of the womb and be quite hard to feel. This can sometimes make removing a coil tricky too. We have different ways of trying to retrieve threads if this happens. You mustn't use tampons for 7 days after insertion, as they can catch the threads and pull the coil out before it's all settled down. We recommend that you take a painkiller of your choice, such as paracetamol or ibuprofen, before the fitting. Also, do bring a sanitary towel, as it's common to get some light bleeding and cramps afterwards. The coil will be effective as a contraceptive after 7 days. If, however, it's inserted in the first 7 days of your period, it will be effective straight away. We can fit a coil at any time in your cycle, as long as your bleeding is light. If you'd like any more information, do have a look at the websites listed below. Thank you for listening, and goodbye.